Hi, my name is Dr. Michael Veselak, and today I'm going to talk to you about peripheral neuropathy and how functional medicine and functional neurology can help with the treatment and some of the causes of peripheral neuropathy. To give you a little bit of background, I've been a chiropractor in Camarillo for over 30 years and have successfully treated several peripheral neuropathy patients and was fortunate enough to lead the Camarillo support group of neuropathy at the Camarillo Healthcare District. So, what is peripheral neuropathy? We're going to talk about that, some of the causes, and what can be done to help to restore your nerves. If you mention it, I will give you a handbook that I printed out, a book that I wrote on the treatment and causes and some self-help tips that might help you along this journey. So, peripheral neuropathy, as you know, is very common. It's affected over 20 million Americans, and it basically is when the electrical wiring of the body gets broken down, and when the hands and the feet don't quite communicate with the brain and the peripheral nerves coming out, causing some confusion. The definition, peripheral means out of the center, neuro means nerve, pathy means abnormal. So basically it means abnormal sensation or messages of the nerve coming out of the periphery from the brain and the spinal cord. So there could be several signs of peripheral neuropathy, and I'm sure you've experienced some of these if you're watching the video. You can have numbness, burning feet, cramping, an electrical type pain, difficulty walking, difficulty sleeping, sometimes a tingling feeling, loss of balance is very common. You could have weakness and or swelling. Sometimes people have a combination of some of these symptoms, and these 10 things represent what most people experience when they have peripheral neuropathy. So the symptoms basically depend on what nerves are affected. You can have the sensory nerves affected, which affects sensation, the motor nerves, which control the muscles in the body, or your autonomic nerves, which go to the glands and different organs of your body, can be affected. All three can have peripheral neuropathy type symptoms. So when you have sensation changes, you can have a numbness, a tingling, a burning sensation, and these are more when the sensory nerves get affected. It will extend out from the center of body down to your feet, where, usually when you first wake up in the morning, you have troubles kind of feeling your feet, or sometimes even at night you get this burning sensation while you're lying there. The motor nerves control movement. So when they're affected, you can have weakness, you can have cramping, you can have a loss of muscle tone, difficulty with just normal movement and or balance. I've noticed in our office, the common thread of all peripheral neuropathy patients is one thing. They all have a metabolic component. And that's what makes it so difficult to treat. Most of the time, everybody's trying to treat the symptoms of the feet and or the hands or the legs, but nobody really gets down to what the root cause of the problem is. Well, on the left, you can see there's a lot of different things. We have peripheral neuropathy, thyroid conditions, diabetes, fibromyalgia, chronic fatigue. All of these conditions, these chronic health conditions that I've listed on the left, all have a metabolic imbalance, which could be anemia, inflammation, food sensitivity, hormonal imbalance, autoimmunity. There are all so many different things that can cause these underlying problems such as peripheral neuropathy. So what we try to do in our office is we get to the cause. We try to figure out what the root cause of the problem is, so we can actually not only help with the symptoms, but help the patient in later years so their peripheral neuropathy becomes much improved, if not gone. We usually see about a balance of about 60% are neurologic issues, 40% is metabolic, and this can change per patient. There is no set recipe, there's no set formula. Every patient that comes into our office, there is a different cause and a different reason why they experience this. And again, that's why it is so difficult to treat for so many practitioners. When we eat food, we basically get energy. That's our metabolism. So when I talk about metabolic issues, it's we are not quite getting the energy or the food supply to our nerves to help them function properly. So these nerves then can die. 30% of our energy goes to what system? our hormonal system, digestive, nervous, immune, cardiovascular? You probably have guessed the answer since this talk is on peripheral neuropathy. It's our nervous system. So our brain and spinal cord and our spinal nerves are basically take most of our energy. So if we have some underlying component where we're not quite getting the energy necessary from metabolizing our food, our nerves are going to eventually suffer, degenerate, and that's what happens usually as we get older. The chronic buildup of a lot of things that we've done through our life catches up to us, and these nerves start to begin to die, and the vessels don't quite bring the blood flow there to help it heal anymore. So the nervous system basically is composed of the brain, spinal cord, and all the nerves. And as I stated, we need proper metabolism for a well-functioning nervous system. If we do have metabolic problems, they always will lead to a peripheral neuropathy issue. That is the underlying cause. Some of the other cause of peripheral neuropathy is statin drugs is a very common cause. Sometimes back issues, spinal stenosis, arthritis, degenerative disc. You can have diabetes, which we're all familiar with, diabetic neuropathy. Sometimes just chronic inflammation, which can be caused from a lot of different things. Could be a food sensitivity, different infections we have in our body, sometimes autoimmune issues, hormone imbalances, high insulin levels. And then we can actually have a chemo-induced type neuropathy, which actually can also affect the nerves, cause the nerves to degenerate and sometimes, die off. So I kind of mentioned statin drugs, and basically what statin does, the statin drugs, it does inhibit the formation of cholesterol. And cholesterol, why it's important, it makes up a sheath. The lining of the nerves is called the myelin sheath, and when you don't have enough cholesterol, this sheath can actually, it can start to deteriorate actually. Statin drugs also inhibit the formation of CoQ10, and oftentimes people are depleted of CoQ10 when they take statin drugs. So we usually like to recommend when somebody comes to our office, if they're taking a statin, also take CoQ10 to prevent, dysfunction of the nerves from the inhibition of the CoQ10 formation. So statin drugs actually are the leading cause of peripheral neuropathy. They did a study in the Neurology Journal in 2002, and they said statin cholesterol drugs increases the risk by 16 times. Now, I am not saying you need to get off your statin drugs. There are reasons why you take it, because your cardiologist, your internal medicine doctor told you to. But what I'm suggesting is if you do need to take the cholesterol medication, you need to take the CoQ10 also. I think we should be aware that sometimes cholesterol really isn't the issue. I know everybody, as far as heart disease, they believe cholesterol is the main culprit, but really it's the inflammation within the vessels that create the issue. It's not so much the high cholesterol, it's basically what the arterial wall is doing if it's inflamed that creates the increase in heart risk. So through the years, we've been supplementing a lot with the statin drugs, and actually the risk of heart disease has not changed in this country at all, because our inflammatory things that we do with our diet have not really changed. Cholesterol won't clog your arteries. It's the inflammation that causes the arteries to become more sticky, the endothelial layer, and that actually will cause more plaquing within the arterial wall. So the second most leading cause of peripheral neuropathy is damage to the lower back. So you can have stenosis, which is a narrowing of the canal where the nerve comes out. You can have a degenerative disc or bulging disc and or arthritis. These are extremely common as we get older, just the wear and tear, normal wear and tear of the body through the years. So when your spine becomes more compressed, it places more pressure on the nerves. You can see a chart here of the nerves, and in the lower back, basically the big nerve that comes from the L4, L5 nerve root and travels all the way down the leg is the sciatic nerve. We're all fairly familiar with that term. So what we try to do is we do a procedure in our office called spinal decompression to actually try to open that space up a little more within the canal and rehydrate the disc to create a little more space and decompress the spine. We actually have 3 decompression tables in our office that we use for a lot of our peripheral neuropathy patients. The third leading cause of peripheral neuropathy is diabetes and insulin resistance. So nerves need energy to survive, and glucose is the energy. Glucose is the main energy of the nerve, and insulin is a hormone that allows glucose to get into the cells and into the nerve. When you're diabetic or insulin resistant, this glucose can't quite get into the cells, and the nerves will be affected, and they eventually will have problems, and they can become fatigued or degenerate, and then situations like numbness, burning, tingling can result from that. So key is it's about inflammation. You need to decrease the inflammation in the body. Inflammation, basically, if you break it down, means to ignite. So, this says you cannot build a house if it's on fire, which makes sense, right? If your body's in a complete state of inflammation, you need to lower the inflammatory levels of the body to allow it to heal. So that's one of the things that we do with our patients. We'll evaluate them completely at a metabolic and a musculoskeletal as well as a nerve exam to determine where the inflammation is really coming from. So some common cause of inflammation are food sensitivities. It's really common these days. A lot of people are having troubles digesting certain foods due to the way we're processing these foods now. So what's real common is, the protein in wheat, gluten, and the protein in dairy, casein, is becoming more and more difficult to digest as a result of the way they're pasteurizing or hybridizing our wheat. So you can also have hidden gut infections. It's common. You can have bacterial overgrowth, such as H. pylori. Sometimes parasite issues can create infections. So we actually look at labs and run certain labs to really determine is where the source of the inflammation is coming from. Our diet these days are heavily laden with more omega-6, which are the unhealthy fats, rather than the omega-3s, such as your olive oils. And this creates inflammation. And then again, hormone imbalances and insulin resistant and or high glucose can create inflammation in the body. So what we do is we like to have our patients on their initial evaluation bring in their blood work. We want to look at the most comprehensive, most recent blood work, and if it's been within the last 6 months, we probably don't need to run more labs. But we like to look at the whole patient to determine, again, what the root cause is, and that really leads to our success with our patients. So a lot of our patients, they come here and go, oh, my labs are good, my doctor says they're perfect, I have a little high cholesterol, but I'm taking, cholesterol meds, but actually he's very pleased with my labs. And we tend to look at it more from a functional viewpoint. And functional medicine or functional lab values is we take normal values and we just shrink them up a little bit. We tighten those values so we can look at patterns. Why is this patient not feeling better? So most lab ranges are based on a bell curve. So who's ever gone to the lab that year, they plot along a bell curve and determine what the normal values are. We have found that a lot of times that the ranges from the lab, even though the lab says they're normal, patients still can have symptoms, which I'll give you an example here, is the normal range for glucose for a laboratory is 65 to 110, or some labs 65 to 100. So if you're above 100 or 110, it means you're diabetic. And if you're below 65, it means you're hypoglycemic. Now our ranges are 85 to 100, so you can see there's a big difference there. There's almost 20 points in the low end difference. And if we have a patient that's even 83 on their blood glucose, we know they're experiencing hypoglycemic symptoms, which can create inflammation in the body, which we do want to control. If they are even in their 70s like 79, 78, they're definitely having significant symptoms with hypoglycemia, which will create inflammation in the body. So again, we look at the functional ranges so we can look at patterns so we can figure out a way to make you feel better. So we never really think about this, but all of our sensation in our body really comes from our brain. So if you can't feel your feet, what does that really mean? Does it mean we're not getting quite good impulse all the way up to the part of our brain called the cerebellum, which interprets this, over to our parietal lobe, which is our sensory lobe? We'll actually take the time and evaluate how the cerebellum, our balance, posture, motor control is doing. We'll take a look at the parietal lobe, your joint position sense, and 2-point discrimination. We run different tests to determine how these lobes are functioning. And if they are not doing well, we actually will give very specific exercises to get the body and the brain to start to function properly. So when I first started chiropractic 30 plus years ago, we did not know the brain can change. When we dissected the brain, we were looking at these cells called the glial cells, and we didn't even know what they did. And now we realize these are a huge marker for inflammation. That's where, and then they've done plenty of studies now that say the brain is neuroplastic, that given the right exercise, just like any muscle in our body, we can change. So here, they did a study a long time ago. This is back in the year 2000, and they said if you cut your nerve in a specific place, through time the body will compensate and you will actually experience the sensation back in that foot if you do the right exercise to kind of bring that up. So there's a part of our brain, it's called the somatotopic map. There's another name, we call it a homunculus, and they've outline that every single part of the cortex of the brain has a sensory component. So if you touch a certain spot, they know that goes to the feet. And if there's another point of the brain, they know that's the lower back. So what we've seen a lot in our office is they give the feet a really, really big area on this somatotopic map, and they give the lower back just a real small, tiny space. So if people are actually having lower back issues, there's almost a spillover on this somatosensory map, and the patient will begin to experience feet problems as a result of the lower back. So nerves are basically neurons, and to get neurons to survive, you need two things. You need fuel and activation. Fuel is glucose and oxygen. Those are the two things we need to survive. So as I talked about, our glucose levels need to be a certain range, 85 to 99 for optimum health. If you don't have either one of these, you're going to have inflammation, and it's going to eventually affect some of your neurotransmitters, serotonin, dopamine, tryptophan. It might affect the way you sleep. It might affect your moods. It might create anxiety or depression. So the brain also requires activation. The brain is a muscle. The brain likes to be worked. And when it's worked in the right way, it can help bring sensation back to your feet and or hands and or balance. So in part what we do in our office, we'll give brain-based exercises, things that stimulate those parts of the brain to give the right input all the way down from the brain to the spinal cord to the peripheral nerves to help them heal. So our clinic is really the first clinic in Ventura County that utilizes microcurrent therapy, cold laser, brain-based exercises, and functional medicine. And in part, that's, again, our success. We do a comprehensive approach, getting to the root of the problem and then helping to fix and restore the damaged nerves. So microcurrent, basically what it does, it stimulates the nerves, it blocks the pain, improves blood flow, and it helps with energy within the cell. So it does this by releasing ATP. So there are a lot of different forms of microcurrents. The one that we use resonates very strongly with the vibration of the body. The hertz is 7.83 hertz, and it's been proven this is very effective to help heal nerves when stimulated in a proper way. We also utilize cold laser. We like the M4 laser. That's what you see in the picture here. We've had 4 lasers that we've used through the years, and we've come to see the best results with this laser. It's powerful, penetrates, there are no side effects, and it does a lot of different things, such as stimulate the body's own ability basically to heal itself, and again to release ATP within the mitochondria of the cell, which is the energy of the cell to regenerate faster. So many of you have heard of anodyne therapy, and anodyne therapy for a while was a covered Medicare expense. So some doctors were given anodyne therapy for the treatment and relief of peripheral neuropathy. Unfortunately, anodyne therapy is a non-coherent light therapy, and the truth is it didn't work. So Medicare stopped covering it, and it's just not a very effective treatment, as many of you probably have found out. So other things that we do in our office, we do the microcurrent, we do the class 4 laser like I talked about, and then we'll also do a vibration. The body likes vibration with oxygen therapy. Remember, it likes fuel, which is glucose and oxygen, and then activation. So we'll actually promote the healing by giving the oxygen, and then we stimulate the nerves through the vibratory pathways. We also will give you a home unit, a rebuilder. There's a picture of it there where you actually put this on yourself at home to stimulate these nerves on a regular basis. So the treatment in the office is quite effective, but when we coupled it with home therapy such as this, our results were much, much better. So when you're finished with the treatment, the rebuilder unit is yours. And so you can, if you start to have the symptoms return, which might happen, but we don't see that too frequently, then you have the rebuilder to do, you'll know how to do it. You can do it for yourself to help stimulate those nerves to regenerate. We also, we'll recommend some nutritional supplements. We do like this EFAC cream because it has essential fatty acids, which helps the body heal. And then we try to look at what the underlying cause is. So maybe we'll look at labs and order some other labs. So what I want you to get from this lecture is it's just not one thing that causes peripheral neuropathy. It's a lot of different things. And you have to address the underlying metabolic neurologic component to have success. Now, again, if we just treat your feet, it's not going to work. If we just treat you metabolically, it's not going to work. If we treat metabolically, neurologically, give home exercise as well as the in-office treatment, our success rate is great. So we like to look at all the lab work that you have. We want to look at the most recent lab so we can see what is driving the inflammation. Remember what I said, the common thread that we have seen is there's always 100% an underlying metabolic component that causes the peripheral neuropathy. The other thing is we usually will put you on an anti-inflammatory diet. If the house is on fire, it's hard to get the body to heal. We need to lower the inflammatory levels of the body. And then we will begin to activate the peripheral nerves. We'll activate them through the electric microcurrent, the vibration, the rebuilder at home, our home-based exercises. Oftentimes we'll utilize a spinal decompression therapy, the cold laser, and the combination of all of them, every single one of these components, is what's led to our success. So we do a exam because we want to objectively measure the improvement. And so there's a standardized test. It's called the Toronto Scoring Scale, and the normal score is 74. So when we do a test, and we do a test and maybe the patient is 26, then by that number, when we redo the test, if it's all of a sudden 50, we've already known we've made 100% improvement. So we like to standardize, not just how you feel, but we want to objectively measure the improvement as well. So what's next? Make your appointment. Come on in. We'll do the Toronto scale exam. We'll do the Berg balance test. We'll evaluate you from a metabolic standpoint through your blood work, neurologically, through different tests from your brain, the cerebellum and parietal lobe, to determine how everything in your body is functioning so we can put together a good course of treatment, very specific to you. So the first 2 visits, we go through the examination, we talk about things, and the second visit is we'll go through all your findings. We kind of like it if your spouse is with you or a significant other, just so when we go over the test, we give a lot of information. Then the 2 of you hopefully can absorb it, make a decision if you want to pursue treatment in our office. It helps if you bring shorts or sweatpants and a t-shirt so we can easily examine you, but if not, then that's not a problem. We can, we have things in the office that we can examine you. We like our paperwork to be filled out, that way we can really get to the bottom of it within the first 2 visits, so we're not taking any of your time, and we can figure out a good approach to get you on the right path. So we have a fairly busy office here, and I do a lot of different types of treatment, not only the peripheral neuropathy. So I try to limit how many peripheral neuropathy patients I accept per month. We accept 5 new patients a month, and the average cost for the exam that we do comes to about $450. But today, if you're watching this DVD and if you're interested, we will give the exam for $75 for the first 2 visits. And there's a couple rules that I think are really important if you're deciding to have treatment in this office. First, you have to be willing to make serious life changes. You can't just let the treatment, work by its own. You have to become involved. You have to do the home therapies. You have to do the anti-inflammatory diet. You have to do everything that I tell you, and the patients that do get better. And that's exactly what I'll tell you the first day. If you listen to me, you're going to improve. And along those lines, you have to take accountability for your own health. You can't blame anybody else. You can't blame the insurance companies. You can't blame anything. You just have to say, it's time that I'm going to get better, and take accountability for that. Medicare pays a very, very small portion of the treatment we provide, but we're more than happy to verify your insurance and your secondary insurance to see if they will cover. Generally what we found is they cover a small portion, and then there will be an out-of-pocket expense, and we'll go over what that expense will be for you. It usually runs about $200 to $300 per month, and then occasionally we'll recommend some supplements. They'll be a little bit extra. So I want you to think about these things. On a scale of 1 to 10, how serious is your problem? Is it affecting your life? Is it affecting your sleep? Are you not able to play golf or take walks? Are you nervous about falling? These are questions that only you can answer. And you got to realize how important is this to you to get this care. Is it getting better? Is it going to get better on its own? What I will tell you is peripheral neuropathy does not improve without intervention. The medications, as you've probably already figured out, doesn't really help too much. They have to keep upping the dose, and there's side effects. So where do you see yourself in 3 years? Has it affected your relationships, your ability to enjoy your life? And if you could do 3 things if you didn't have peripheral neuropathy, what will those 3 things be? Do you want to travel more? Are you worried about it? Are you going to be able to walk? So on a scale of 10, how serious are you in eliminating this problem? And lastly, due to time constraints, I can only accept those that are truly committed. As I stated, I accept 5 new peripheral neuropathy patients per month. That's it. And we do a lot of other things in the office. We like to be diverse, and I want to only accept the committed patients, the ones that are really serious about improving their health and getting better.